Hi Doctor friends, welcome to my YouTube channel PG Dr. INDRANJU. Today's topic is about the pharmacology one-liner part 1. It is very important topic and I will describe the all things regarding the one-liner. Start with the drug enhancing insulin secretion are the sitagliptin, exenatide, glimepiride. Here the one thing is the pioglitazone reduce blood glucose and HbA1c without increasing circulating insulin. I have uploaded the video about the classification of the anti-hyperglycemic drug. Again, for the revision purpose, the drug enhancing the insulin secretion. Here the parenteral drug, already I have told the GLP analog glucose like peptide which enhance the insulin secretion is the exenatide, liraglutide, albiglutide and dulaglutide. Next one is the which release insulin which are also known as the secretagogue. It is the meglitide. It includes rapaglitide, netiglinide. It is the postprandial hyperglycemia and the sulfonylurea, the first generation and the second generation. So this is the for revision purpose. Next one is the protease inhibitor. It is the nalfinavir. The protease inhibitor, the trick is for the that is NAVIR. The trick is NAVIR. In that protease inhibitor, in the all protease inhibitor, NAVIR as is suffix in the last word. So the protease inhibitor is like indinavir, navir is the last word, ritonavir, lopivir, saquinavir, fosquemprivir. This is the trick to remember. Navir is the last word. Next is the Genobiotics. The Genobiotics are metabolized by CYP enzyme CYP to increase water solubility. The maximum drug is metabolized by the enzymatic activity of CYP450. Approx to 50% drug is metabolized by CYP enzyme. Next one is the drug considered as the pregnancy category B. The category B that indicates the safe in the pregnancy. Any drug which are used in pregnancy are categorized under the A, B, C. So the B category is the safest and C are not safest, D are not safest. So all these are studied in the animal beings. It includes brimonidine, any other drugs which are included in the category B is like the anti-vomiting or anti-nauseating is metoclopramide. For pain relief, the dicyclomine. Antibiotic like amoxicillin, penicillin group are safest in the pregnancy, which are included in the Cat B. Next one is the therapeutic indication of the cholinergic drugs. Cholinergic, that means the cholinergic analog, that means which have property like parasympathetic activity. This includes the glaucoma, postoperative atony, myasthenia gravis. These all are the cholinergic drug. I will upload the video regarding the autonomic nervous system, which all drugs about the autonomic nervous system. Next one is the antimuscarinic, not a tertiary amine, is the glycopyrrolate. Next one is the dexmedetomidine, is a centrally acting beta 2 receptor agonist. These are AIIMS question. Next one is the true about NSAID. NSAID, non-steroid anti-inflammatory drugs, reduce the effect of antihypertensive medication, can be used by topical route of the administration and cause nephrotoxicity. Next one is the lithium toxicity indication by the plasma level above the 2 milliequivalent per liter. Next one is the associated with development of the edema. It is the amlodipine, cyclosporine and estrogen. I will not going to describe all the things about that, due to I will upload the all video regarding the pharmacology. So, and this is the topic which are asking in the NEET PG, AIIMS PG, DNB, which are repeated in such PG exams. So next one is polypeptide with an average molecular weight of 30,000 exert oncotic pressure similar to albumin, not antigenic but to be watched for rare hypersensitivity, is the polygelyne. Next is the long-term use of PPI. Use is associated with increased incidence of risk of community-acquired pneumonia, Clostridium difficile infection, hip fracture in the omen, loss of the libido, and more things which are long-term use of PPI. The next one is the true about the penicillin G, used for the treatment of the rat bite. Penicillin G also used in the rheumatic fever, also other things which are which I will upload such. The best treatment for the infection due to Pseudomonas aeruginosa infection is the best treatment. It is the piperacillin tazobactam. Next one is the third generation anti-MRSA cephalosporin among the following. It is the ceftriaxone. Next, a 35-year-old man present with the antibiotic associated diarrhea caused by Clostridium difficile. Drug effective is the oral vancomycin. Due to antibiotic associated diarrhea is by the Clostridium difficile. Next one is the drug used for the treatment of the chronic hepatitis. It is the entecavir, lamivudine and telvivudine. The next one is the most effective treatment for the severe falciparum malaria among the following is artesunate. The artesunate is main drug regimen for the malaria treatment, especially falciparum. Next question is true about paclitaxel. Paclitaxel, it binds to microtubule and promotes stabilization of the tubulin used for breast cancer, ovarian cancer, lung cancer, and the myelosuppression and the alopecia are the main side effect used in breast cancer, ovarian cancer, and lung cancer. And the side effect will be myelosuppression, alopecia. Next is the drug approved in the man for advanced prostate cancer is the goserelin. Goserelin. Next one is the true about rituximab. It is a chimeric antibody that target the CD20B cell antigen. It is the first monoclonal antibody that received FDA approved for relapsed indolent. Here the CD20 is the marker for the B cell. Indolent lymphomas and toxicity is mainly associated with infusion reaction. Next one is the abatacept. Abatacept is the T cell co-stimulation inhibitor is used for the treatment of rheumatoid arthritis. Abatacept. In the rheumatoid arthritis also the effective drug for the pain and swelling is and the NSAID includes the salicylic acid and DMRD drug methotrexate. It is the drug converted into active metabolite are the fluoxetine, cyclophosphamide, diazepam, which the drug converted into active metabolite. Methacholine is the M2 receptor agonist. Beta 2 agonist cause analgesia, sedation, anxiolysis. The peripheral vasospasm is observed with anti-Parkinson drug is the bromocriptine. Due to potentiating action of lithium to non-depolarizing muscles relaxant, how many days before lithium should be stopped before administration of muscles relaxant? It is many times repeated question. It is 2 days. Next is the true about methadone. Methadone, it is a long-acting beta receptor agonist. It is rapidly absorbed from the GIT and is detected in the plasma 30 minutes after oral administration. And primary use of methadone is the relief of the chronic pain. The side effect of action of furosemide is the thick ascending loop of Henle. The pair of the drug and its indication match correctly. Octoroid, VIPoma associated diarrhea. Desmopressin is the diabetes insipidus and HCG, infertility in the man and the woman. Next one is the correct match for the drug and match of the action. The brimonidine decrease aqueous production. Next one is the Rho kinase inhibitor is the fasudil. It is also repeated many times in the AIIMS PG, FMGE, PGI and DNB. Many medical PG repeat this type of question. So make focus on Rho kinase inhibitor. The duration of action of the flumazenil is the 40 minute. Flumazenil, it is the antidote of the benzodiazepine overdose or benzodiazepine toxicity. The flumazenil is the antidote. Next one is the drug having both alpha and beta agonist activity is the epinephrine. Epinephrine, the drug that can be stopped without any withdrawal symptom is the fluoxetine. The ability of the body to eliminate the drug from the body is called as the clearance. This is also many times a repeated question. The truth about carbamazepine has been known to cause Stevens-Johnson syndrome. Next one is the tricyclic antidepressant produce side effect like dry mouth, urinary retention due to the action of the muscarinic receptor. Cholinergic drug used in the glaucoma, myasthenia gravis, post-surgical ileus or atony. It is also repeated question. Next one is the anticholinergic drug not crossing the blood-brain barrier is the glycopyrrolate and hyoscine butyl bromide. Glycopyrrolate is the used in surgical management of the patient as compared to infractionated heparin. Low molecular weight heparin has reliable anticoagulant action because it is less protein bound. Heterochromia iridis occurs due to the local application of the latanoprost. The methacholine acts on the M2 receptor agonist, which are also repeated question. The drug causing amorphous hole-like opacity in the cornea is the amiodarone, chloroquine, chlorpromazine. Next is the drug given in pulmonary arterial hypertension is the bosentan. Bosentan also used in the intention tremor. The adrenergic beta receptor causing lipolysis is the beta 3. It is also repeated question. Nitroglycerin is given sublingual as it absorbed rapidly below the tongue because non-ionic and high lipid solubility. Also repeated question. Next one is the drug causing hearing loss. It is the kanamycin, chloroquine, vancomycin, gentamicin, all causing ototoxicity, so causing hearing loss. Diuretics preferred in the mild to moderate hypertension is the thiazide diuretics. Types of enzyme inhibition in the organophosphorus poisoning is the irreversible. The time beings for the organophosphate inhibition within the 12 hour, it is the irreversible inhibition, while that of beyond that it is irreversible reaction. And also many times question asked about the organophosphorus antidote. What is the drug of choice of the organophosphorus poisoning? It is atropine, then EXAMS, pralidoxime. Like time dependent killing and post antibiotic effect is seen with the clindamycin. It is many times, this is also repeated question. NNRTI includes extravirine, delaviridine, nevirapine. The trick for NNRTI inhibitor. NNRTI, that means non-nucleoside reverse transcriptase inhibitor. In NNRTI, The example is like the delavirdine, itavirdine, nevirapine, nevirapine. The trick is that the VIR is the middle word. VIR is the middle word in the all NNRTI inhibitor. Except one thing is the entry inhibitor, which are ENFUVIRTIDE. Infuvartide, you can also remember, it is the entry inhibitor. So E4 entry and EN for infuvartide. The trick is that here also VIR is in the middle word. This is the exception for the NNRTI inhibitor. You can remember the middle word is the VIR, except infuvartide. Infuvartide is the entry inhibitor. Here the next is the antitubercular drug associated with hypothyroidism is the ethionamide is more than rifampicin. Due to it is repeated in the AIIMS question and option was given ethionamide and rifampicin both, then you have to choose ethionamide. The anti-cancerous drug least likely to cause nausea and vomiting is the chlorambucil. And also it is asked that the anti-cancerous drug which causes the nausea, vomiting, antidote or drug of choice for such is the ondansetron. Essential for the ameliorating the toxicity of the pemetrexed is the folic acid and the vitamin B12. Drug used for the treatment of advanced prostate cancer is the goserelin. It is the GnRH. One is the analog, another is the anti. Okay, the analog you can remember is the agonist or antagonist. Agonist is the last word is the relin, RELIN, and in the antagonist it is relix. Trick is the relix. You can easily remember by this. The relix is the terminal word, last word. It is the GnRH antagonist, while that of the last word is the relin, then it is the analog or agonist. Thanks friends for watching my video. Have a nice day.